Hello dear friends, lung volume introduction. Today I am going to discuss about this topic. Lung volume are also known as the respiratory volume. Respiratory volume means which gases during the inhalations going inside the lungs and which gases are during the exhalations going in the environment at the atmosphere pressure level. So this is called the lungs volume. In a quiet breathing there are the about 15 respiratory cycle per minute, or normally we can say the adult person at the sleep time, at the resting time patients have 12 breath per minute cycle. And each importance to the measure the lungs volume. Lung volume tests are based on the measurement of the volume of the air breathed in and out in quiet breathing and forced breathing. In quiet breathing means the which amount of the air which going inside the lungs, that is called tidal volume. And during the forced breathing the lungs air is going in the lungs, that is called inspiratory reserve volume. And as well as when and forcefully expel out the gases from the lungs to the outer environment, that is called expiratory reserve volume. And these volumes always tend to vary depending on the depth of the respiration, genders, age, body composition, and in certain respiratory disease means the respiratory this depends on the breathing volumes depending on the genders. Means males have the more lungs volume, and as well as the age also affecting that one. Because younger persons have the more lungs volume, and older people's elderly people's have the low lungs volume. And the body composition means if anyone persons have tall and he have the more lungs volume rather than those have the smaller structures person. So we can say these are the gender and age and body structures uh, can affecting the lungs volume, its composition in certain respiratory disease also. Like the patient is having any COPD like disease condition, asthma hai, and the lactic emphysema hai, pleural rub hai, in these type of disease condition also affecting the lungs volume. So depending on this type of factors along our lung volume, it used to define the persons have any lungs related to the disease. Next, it used to find the persons have any lung related disease means the lung volume using to find out the any type of the disease condition related to the lungs in the person. So we can, if the lung volume is decreased means patient has suffering related to the respiratory problems. And next one is the lung volume, or the volume of the air breathed by an individual. The lungs volume are of four types. First one, that is the tidal volume, second is the inspiratory reserve volume, third is the expiratory reserve volume, and last one is the residual volumes. These volumes are tidal volume means that volume during the sleep resting stage person is taking the breath in and out. This volume is called tidal volume. It is volume approximately 500 ml. Next one, the inspiratory reserve volume. Inspiratory reserve volume means when gases inhaled with forcefully. This is the inspiratory reserve volume. Next one is the expiratory reserve volume. Expiratory reserve volume means after the expiration, persons forcefully expired the gases in the environment from the lungs to environment, that is called expiratory reserve volume. Next one, the residual volume. After the expiratory reserve volume, some gases remain inside the lungs. Those are preventing the collapsing of the lungs after the expiratory reserve volume. So this is called residual volume. It always present in the lungs, even the lungs we expiratory reserve volume forcefully expel out the gases. After that, this present gas, that is the residual volume. This amount is nearby 800 to a 1000 ml. So one tidal volume is always, before that I have told to you, passes into the and out of the lungs is single normal quiet breathing is the called 500 ml. This one. Next one is the inspiratory reserve volume, additional volume of the air that is inspired forcefully after the end of the normal inspiration, that is the normal volume 3300 ml. Next is expiratory reserve volume, in this additional volume of the air that can be expired out forcefully after normal expiration. So this is volume is 1000 ml. So this is the expiratory reserve volume. Next one is the residual volume. Residual volume, it is the volume of the air remaining in the lungs even after forced expiration. Forced expiration, after which gases remain in the lung side, that is called residual volume. Normally lungs cannot be emptied completely even by forceful expiration. Some quantity of the air always remain in the lungs even after the forced expiration. This normal value is 500 ml. So this is the residual volume. Next one is the lung capacity. So before discussing the lung capacity, I just want to recap out the lungs volume. So lungs volume is divided into four types of the lung volume. First one is the tidal volume. First one tidal volume. Second one is the inspiratory reserve volume. Second is the expiratory reserve volume. Fourth one is the residual volumes. There are the four type of volumes present in the lungs gases. Next one is the lung capacities. Capacities means the lungs have the capacity, how much can gases can go inside the lungs and how much can expel out. So this is the capacity of the lungs, means ability of the lungs, we can say, related to the lungs volume. So lung capacities are the combination of two or more lung volume. So lung capacity are of four types. First one, that is the inspiratory capacity. Inspiratory capacity. Second is the vital capacity. Third one is the functional residual capacity, and last one is total lung capacity. There are the four total capacity. So by this graph we can easily understand the lungs volume and the capacity. So lungs volume and capacity means the inspiratory capacity. So in the diagrams you can see easily, inspiratory capacity means this capacity, residual volume plus vital tidal volume. So this is total is called inspiratory capacity. And second is the expiratory reserve volume, and this is the EVR, the expiratory reserve volume. This percent you can see in this diagram easily EVR जो है. Next one is the vital capacity. Vital capacity, that is the capacity of the lungs total, inspiratory capacity plus tidal plus the expiratory capacity reserve volume. So this overall is called vital capacity. In vital capacity, 3 points involved. First one, residual volume. Second, tidal volume. Third one, expiratory reserve volume. How much gases can inhale person after the normal we can say tidal volume, and how much gases can expel out after the normal expiration. So this overall, this is called the vital capacity. Next one is the total lung capacity. Total lung capacity means the inspiratory lung volume, vital capacity, here we can say tidal volume, and next one is the residual function capacity. This overall comes under the total lung capacity. It is totally 6000 ml per मिनट जो है present होती है. Next one is the inspiratory capacity. It is the maximum volume of the air that is inspired after normal expiration and expiratory position. It includes the tidal volume and inspiratory reserve volume. So tidal volume is 500 and inspiratory reserve volume is 300, 3300. The total is 3800 ml. That is the normal value of the inspiratory capacity. Second is the vital capacity. The vital capacity, it is the maximum volume of air that can be expelled out forcefully after the deep maximum inspiration. Means after forcefully deep maximum expiration, which air of that can be expelled out 8%, that is the vital capacity. Vital capacity include inspiratory reserve volume, tidal volume and expiratory reserve volume. Overall the ability of the lungs, we can say this one. So vital capacity, inspiratory reserve volume 3300, tidal volume 500 and expiratory reserve volume is the 1000. So this is the 48 ml 4800 ml per minute जो है. Normal volume is 4800 ml. This is the vital capacity. Next is the functional residual capacity. So functional residual capacity means it is volume of the air remaining in the lungs after the normal expiration, after normal tidal expiration. So normal this remain gases remain inside the lungs, volume of the gas remain inside the lungs after expiration. So normal residual capacity include the expiratory reserve volume and residual volume. तो दो है इसके अंदर फंक्शनल रेजिडुअल कैपेसिटी के अंदर फर्स्ट वन दैट इज द expiratory reserve volume plus reserve volume. So this is the 2200 ml जो है this one. तो normal value 2200 ml this one functional residual capacity. Next one is the total lung capacity. Total lung capacity means it is the volume of the air present in the lungs after deep inspiration. So after the deep inspirations, which volume of the air present in the lungs that comes under the total lung capacity. So including the all four type of the volumes tied in this the inspiratory reserve volume plus tidal volume plus expiratory reserve volume plus residual volume. So there are the four type of volumes air. So this comes under the total lung capacity. So this is the total lung capacity which is the 3300 reserve inspiratory reserve volume, 500 the tidal volume, and expiratory reserve volume is the 1000 and residual volume is the 1200. The total is the 6000 ml. So this is the normal value of the total lung capacity. If normal value is below than 6000 ml, that means person have the total lung capacity is decreased, or if more than 6000, that means the total lung capacity is increased. So this is the lungs total lung capacity. So easily you can here understand this is the lung capacity diagram के through. तो inspiratory capacity is the from the left side I just start. So inspiratory capacity is the IRV plus TV. So this is the inspiratory capacity. Fractional residual volume, this is the residual volume plus expiratory reserve volume. This is the fractional reserve volume. Or their side is the VC is the vital capacity is the inspiratory reserve volume, tidal volume, and expiratory reserve volume. And next one is the TLC. This is TLC is a total lung capacity, overall inspiratory reserve volume, tidal volume, expiratory reserve volume, and reserve residual volume. This is the total lung capacity 6000 ml जो है एयर जो है this 1% lung capacity के अंदर. Next one is the lung volumes and capacity. तो inspiratory reserve volumes, tidal volumes, expiratory reserve volumes, and residual volumes. Next one is the inspiratory capacity, functional residual capacity, then vital capacity, then क्या total lungs capacity. So this is the overall lung volume and capacity. Next question is how we measuring the lungs volume. Air is going inside and coming outside, we inhaling and exhaling, but this volume of the air how we can measure. So how we can measure, its name is called spirometers. Spirometer is helpful to measuring the lungs capacity. Spirometer is an apparatus for measuring the volume of the air inspired and expired by the lungs. So you sit and breathe into a small machine called the spirometers. So this medical device records the amount of the air you breathe in and out and the speed of the air breathe. So this is called a spirometer. So this spirometer is helpful to find out the volume of the air inspired and expired by the lungs. So this is the diagram of the spirometers. This is diagram of spirometers. Thank you. This is topic is completed about the lungs volume and lungs capacities. So if you have any doubt, you can send the message to me regarding that one, and easily I can explain to you about this one. Okay, thank you. Bye bye.